In its latest part of our health series, we're going to be going over some nutrition stuff that pays for your medical care and food, and actually saves you money on your food bill, nutrition bill, medicine bill, doctor bill, and then healing back pain. Johnny Sarno. We'll start with that. We're just going to go over because I love for you to buy the book. I think it is free recording on YouTube, at least to sample it, but we'll just go over the introduction and the appendix. This book is a successor to Mind Over Back Pain. All of his books are excellent, but this one I feel like is the easiest read and the simplest. It was published in 1984. It described a medical disorder known as tension myositis syndrome. Oh, it's myoneural now. He changed it from myositis to myoneural. I called it myositis in the last one, which I have had reason to believe is the major cause of the common syndromes of pain involving neck, shoulders, back, buttocks, and limbs. In the years since the first publication, I have further developed and clarified my concepts about how to diagnose and treat TMS, hence the necessity for this book. Over the years, the increasing incidence of these pain syndromes has created a public health problem in the impressive proportions of impressive. One continues to see that the statistic that somewhere around 80% of the population have a history of one of these painful conditions. An article in Forbes magazine in August 1986 reported $56 billion are spent annually to deal with the consequences of this ubiquitous medical disorder. It is the first cause of worker absenteeism in this country and ranks second behind respiratory infections as a reason for a doctor visit. All of this happened in the past 30 years. Why? After a few million years of evolution, has the American back suddenly become incompetent? Why are so many people prone to back injury? And why has the medical profession proven so helpless to stem the epidemic? In this book's purpose to answer those and many other questions about the widespread problem, the thesis will be advanced that, like all epidemics, this is a result of medicine's failure to recognize the nature of the disease, that is, to make an accurate diagnosis. The plague ravaged the world because no one knew anything about bacteriology or epidemiology at that time. It may be hard to believe that highly sophisticated 20th century medicine cannot properly identify the cause of something so simple and common as these pain disorders. But physicians and medical researchers are, after all, still human and therefore not all-knowing and, most important, subject to the enduring weakness of bias. The pertinent bias here is that these common pain syndromes must be the result of structural abnormalities of the spine or chemically or mechanically induced deficiencies of muscle. Of equal importance is another bias held by conventional medicine that emotions do not induce physiologic change. Experience that TMS contradicts both biases. The disorder is a benign, though painful, physiologic aberration of soft tissue, not the spine, and it is caused by an emotional process. I first appreciated the magnitude of this problem in 1965 when I joined the staff of what is now known as the Howard A. Rusk Institute of Rehabilitation Medicine at New York University Medical Center as the director of outpatient services. It was my first introduction to large numbers of patients with neck, shoulder, back, and buttock pain. Conventional medical training had taught me these pains were primarily due to a variety of structural abnormalities of the spine, most commonly arthritic and disc disorders, or to a vague group of muscle conditions attributed to poor posture, under-exercise, overexertion, and the like. Pain in the legs and arms was presumed due to compression, pinching of the nerves. However, it was all clear how these abnormalities actually produce the pain. The rationale for The treatment prescribed was equally perplexing. Treatment included injections, deep heat, and in the form of ultrasound, massage, and exercise. No one was sure what these regimens were supposed to do, but they seemed to help in some cases. It was said that the exercise strengthened the abdominal and back muscles, and that this somehow supported the spine and prevented pain. The experience of treating these patients was frustrating and depressing. One could never predict the outcome. Further, it was troubling to realize that the pattern of pain and physical examination findings often did not correlate with the presumed reason for the pain. For example, pain might be attributed to degenerative arthritic changes at the lower end of the spine, but the patient might have pain in places that had nothing to do with the bones in the area. Or someone might have a lumbar disc that was herniated to the left and have pain in the right leg, along with doubt about the accuracy of the conventional diagnoses. There came a realization that the primary tissue involved was muscle, specifically the muscles in the neck, shoulders, back, and buttocks. But even more important was the observation that 88% of the people seen had histories of such things as tension or migraine, headache, heartburn, hiatus, hernia, stomach ulcer, colitis, spastic colon, irritable bowel syndrome, hay fever, asthma, eczema, and a variety of other disorders, all of which were strongly suspected of being related to the tension. It seemed logical to conclude that the painful muscle conditions might also be induced by tension, hence tension myositis or tension myoneural syndrome. Myo meaning muscle, tension myositis syndrome, myoneural syndrome is defined here as a change in state that the muscle that is painful. Change in state in the muscle that is painful. When that theory was put to the test, patients were treated accordingly. There was an improvement in treatment results. In fact, it was then possible to predict with some accuracy with patients who would do well with such would probably fail. That was the beginning of the diagnostic and therapeutic program described in this book. It was emphasized that this book does not describe a new approach of treatment of back pain. Tension myoneural syndrome is a new diagnosis and therefore must be treated in a manner appropriate to that diagnosis. When medicine learned that bacteria were the cause of many infections, it looked for ways to deal with the germs. Hence the antibiotics. If emotional factors are responsible for someone's back pain, one must look for a proper therapeutic technique. Clearly, there is no logic to traditional physical treatment. Instead, experience has shown that the only successful permanent way to treat the problem is by teaching patients to understand that they have, to the uninitiated, that may not make much sense, but it should become clear as one reads on. In this holistic medicine, unfortunately, what has come to be known as holistic medicine is a jumble of science, pseudoscience, and folklore. Anything that is outside mainstream medicine may be adopted as holistic, but more accurately described as predominant. The predominant idea is that one must treat the whole person, a wise concept that is generally neglected by contemporary medicine, but that should give license to identify anything holistic that defies medical convention. Perhaps holistic should be defined as that which includes consideration of both emotional and structural aspects of health and illness. In accepting this definition, one does not reject the scientific method. On the contrary, it becomes increasingly important to require proof and replication of the results when one adds that the very difficult emotional dimension to the medical equation. Therefore, it is not holistic medicine as it is popularly conceived. I hope it is an example of good medicine, accurate diagnosis, and effective treatment, and good science and conclusions based on observation, verified experience. Through the cause of tension myoneural syndrome is tension, and the diagnosis is made on physical, not psychological grounds in the tradition of clinical medicine. All physicians should be practitioners of holistic medicine in the sense that they recognize the interaction between the mind and body. To leave the emotional dimension out of the study of health and illness is poor medicine and poor science. There is an important point to be emphasized through tension myoneural syndrome is induced by emotional phenomena. It is a physical disorder. It must be diagnosed by a physician, someone who is capable of recognizing both the physical and psychological dimension of the conditions. Psychologists may suspect that the patient's symptoms are emotionally induced, but not trained in the physical diagnosis. Cannot say with certainty that they have tension myoneural syndrome, since few physicians are trained to recognize the disorder, whose roots are psychological. TMS falls between the cracks, as it were, and patients go undiagnosed. It is particularly important that the diagnosis be made by a physician to avoid the pejorative conclusion that the pain is all in your head. What do doctors think of this diagnosis? It is unlikely that most physicians are aware of it. I have written a number of medical papers and chapters for textbooks on the subject, but have reached a limited medical audience, primarily physicians working in the field of physical medicine and rehabilitation. In recent years, it has become impossible to have medical papers on tension myoneural syndrome accepted in the face of contemporary medical dogma. For those physicians who might see this book, I would point out that it is more complete than any of the papers I have published and will be useful to them, despite the fact that it is written for a general audience. Judging by reactions in doctors in my immediate environment, most physicians will either ignore or reject the diagnosis. A few doctors in my own specialty say that they see the validity of the diagnosis, but find it difficult to teach such patients. One hopes that the younger generation of physicians will be more capable in dealing with this kind of problem. It is one of the intentions of this book to reach those young doctors. And I mean, big pharma and surgery, I mean, that's doctors. Who else would be involved in this? Masseuses, I mean, many industries share this for a long-term solution, charge more. Judging by the reactions, reach young doctors. What of those who are having neck, shoulder, back, or buttock pain and think might have tension myoneural syndrome? A book cannot substitute for a doctor, and it is not my intention to diagnose and treat through this book. I consider it unethical and immoral to hold oneself out as a physician through a book or a DVD. Pain syndromes must always be properly studied and rule out serious disorders such as cancers, tumors, bone disease, and other conditions. If one has a persistent pain anywhere, it is imperative to see a doctor so that appropriate examinations and tests can be done. The primary purpose of this book is to raise consciousness both inside and outside of the field of medicine, because these common pain syndromes represent a major public health problem that will not be solved until there is a change in the medical perception of their cause. Having stated the purpose of the book, I would be less than candid if I did not report that many readers of the predecessor, Mind Over Back Pain, reported amelioration or a complete resolution of symptoms. This substantiates the idea that it is identification with the knowledge and the disorder that are critical therapeutic factors. Science requires that all new ideas be validated in experience and replication. Before any new concepts can be generally accepted, they must be proven beyond all doubt. It is essential that the ideas advanced in this book are subjected to research study. In the tradition of scientific medicine, I invite my colleagues to verify and correct my work. What they ought not to do is ignore it. For the problem of back pain is too great and the need for a solution is too imperative. We'll continue with the appendix in the next one. Peace, love.